On this episode of the Ask Mike Reinold Show, we talk about using vibrating massage guns in physical therapy. The Ask Mike Reinold Show. Helping people feel better, move better, and perform better. Before we get to the podcast, I wanted to make sure you knew about my free online course on the Introduction to Performance Therapy and Training. If you want to learn how to get started optimizing and enhancing performance, this is the course for you. Head to mikereinold.com/performance to sign up today. Welcome back, everybody, to the latest episode of the Ask Mike Reinold Show. I am up in Boston, Massachusetts at Champion PT and Performance. Lisa Russell, Mike Scaduto, Lenny Macrina, Dan Pope, Dave Tilley joining us for this lovely day of answering questions from you amazing readers, listeners, watchers.
All of them.
Read, listen, and watch.
Yeah.
We are everywhere. That's pretty cool, actually.
Fun.
That's pretty cool. Spotify, by the way, is growing.
Yeah.
Spotify podcasts are growing,
Yep.
and they're doing some cool things. So
I agree.
check it out. But anyway, what are we talking about? Right, you and your questions. If you have questions, head to mikereinold.com, click on that podcast link, and there's a cool form that you can fill out. Ask us anything you want. Len, students today going to be asking us an amazing question. Who do we have?
We have lovely students. We have Andrew King right in the middle here from the University of Hartford. We have on his right, our left, is Austin Riff from Franklin Pierce University in Arizona. And we have Joe Gawet from Virginia Commonwealth University in Virginia. I don't know.
Len, it's been 3 weeks now. Still can't pronounce it. It's been 3 calendar weeks.
It's been almost a month since the last episode.
Joe, show Lenny what it takes to read an amazing question.
All right, Daniel from Birmingham asks, what is your opinion of using vibrating massage guns in PT practice? Do you consider this skilled therapy in order to bill for it?
I love how people jam 3 questions into one sentence, right? That's kind of cool, though. Like, what was his name again?
Daniel.
Daniel from the Ham. Good question. So, vibrating massage gun. So, wait, again, dissecting question. Do we like vibrating massage guns, right? Is it skilled? And how do you bill for it? Which isn't our world, but but that's pretty interesting. So, why don't we start with this? Do we? Who here uses vibrating massage guns?
Like in practice?
Yeah, it's a good point. All right, who likes them? Do we have them here at Champion?
Yes.
Likes them, yes.
We have a lot. Do our clients like them?
Love
Yes.
them.
Love them.
Love.
Something to keep in mind. We'll talk about that. The clients love them. That's interesting. So it must make them feel better, right? Good. Do we use them in physical therapy here?
Yeah.
I think so, right?
I rarely administer the treatment myself.
I feel like I've tried it a couple of times and just felt bad about it the whole time. I feel like
Lazy man.
Well, you know what? It comes down to a big question that always happens in physical therapy. We have limited time with our people. Even if you're in a one-on-one setting with the person, like we are here, even if you're in that setting here, we have limited time with our people, and you have to pick and choose what we decide to do with them. Now, that being said, I am one of those people that like to think about the end game and what is our outcome that we're trying to achieve, and then we'll figure out any way to get there, in my mind, right? So I think what I'm saying here is I don't necessarily think it's a bad idea, but I think none of us are currently using it, and maybe we kind of talk about that as to why. Right? Because we're big vibrating massage gun fans. We have them, we use them here, but I don't think we use them in physical therapy. Who wants to start and kind of talk about that? I kind of led into that a little bit, but I don't know. Dan, you said you've tried it sometimes. Why don't you comment on, why you decided to use it on that person and why aren't you using it more?
Yeah, I guess this kind of ties into Dan's original question, whether or not it's skilled physical therapy. I think it's a tool just like anything else, right? So if you have someone that say, you feel like the muscle is related to their pain and or you're trying to gain length in that muscle, something along those lines, and you think that the gun is going to be the best possible tool you have at your disposal, then yeah, you use your brain, you figured out the area that's limited, you want to try to address this, and the tool that you have is the best for that, That being said, Mike kind of came to this conclusion that we don't have all the time in the world to work with our patients. So is it always the best tool that we have at our disposal? I would say a lot of times it's not. A lot of times I'm using my hands, and maybe I'm using some needles. Oftentimes I'm outside teaching people exercise technique, going through exercise programs. So it's not always going to be the best thing that I do use, but I do think it's probably going to be beneficial in some areas and some people, especially people that like it, you know, have that buy-in for it. So
Right, I think that's well said. And then I think the other thing too with is this skilled therapy and do we use it, is if it's something that they can do to themselves equally as well, I think I question, it's almost like then an exercise for me, right? Like it's more prescribed as an exercise, like, all right, go do your vibrating gun. Like meaning like, I don't, you know, why am I doing that, you know, for you? I think that's another thing that kind of comes up a little bit sometimes. So, okay, why would we use it? What's a scenario that would be appropriate to use it as a skilled therapy?
I think the skill is deciding who would benefit from it more than someone else, and when to use it and where to use it.
Perfect.
How long. And that's the skill involved, not the actual administering of the modality.
Perfect. I could not have said that any better, Mike. I mean, the skill is you decided that for what was happening, this was the best tool for you to use. So I think we've now officially answered the question, is it skilled therapy? I think we could argue it technically is, because it's not the tool, it is your decision to apply it that was skilled. Okay, so we got that. That's an interesting kind of point right there. I think if there's other things that we can do, then obviously, you know, that's on the table too. But anybody disagree or anybody think differently? But I think Mike nailed the skill. The skill is our decision-making process, right?
Yeah, I would agree. I think, again, you guys mentioned it, but we're trying to maximize the time they need us for,
Right.
which is like, you know, the critical thinking skills, the creation of a program, the teaching of specific exercise selection technique. And I don't think it's bad to have that on your list of things to maybe do if manual therapy is appropriate, but I feel like there's so many other things that they want me to be involved in that I'm trying to take the big rocks down first before I do that. You know, maybe in follow-up treatments it's more appropriate, but definitely in the first few, it's not really on the top of my list.
Yeah, you whip that out on day one, you're gonna lose some people.
Yeah.
You know what I mean? They're gonna be like, well, I can do this myself. Why am I coming for you to do this? Like, you know, that's always an interest. Is there any specific thing that we think that this would be perfect for?
Recovery maybe on your own.
Yeah, well, I meant as a skilled therapist, but right, yeah, no, we're pro massage guns for, you know, for your own recovery and stuff, but what about like tone?
Yeah,
Like,
I was gonna say kinda,
spasticity and tone or something like that, which happens, right? Like doing that for like a good, you know, 30 seconds to a minute or whatever it may take to reduce some spasm and some tone, so then that way maybe your additional things could have a better impact. I like that, right?
Kind of treat heat too, you know? Heat is sometimes just like there to relax so you can do better manual therapy.
Yeah, but I don't think we see a ton of people in spasm, right? But I think that's kind of our point. So maybe it's not there, but you know, I think that's kind of, you know, that's kind of one way we would do it.
yeah, and I don't do this a ton personally because I'm not like going crazy in terms of manual techniques, but as a manual therapist, you're probably going to be overusing your hands, your fingers, that type of thing. I think it's another tool that probably has a similar effect to some of the other things that we do that you could probably put in your arsenal so you don't end up injuring yourself and keeping yourself safe over the course of time.
That's a good point, right? Another good pro for it. So, so I mean, I think solid answers right now. So just to recap a little bit, we all are very pro the massage guns, right? Our clients love them. Our fitness clients, our athletes, I mean, they love them. They end up buying their own oftentimes. It is impressive. So clearly they make them feel better. They feel more mobile after. They feel like they recover a little bit better. They love doing them before they train. They do their sporting activity, whatever. So these are good devices, right? I'm not here to tell you why or the specifics of it, but I think we're all pro using them, right? We use them here all the time. I think we agree with you that there is a question, is this skilled? But by far, the biggest thing that you're doing here is it's your clinical reasoning that is the skill to decide if it's appropriate for the person. So I think you could argue it's skillful, but I do think if you are overusing this and doing it too much, I think you're barking up the wrong tree, right? Is that a good kind of summary?
Yeah.
The best way I think you could use this as giving the person a tool to try to maintain some of the things that maybe you've helped them with your treatments that they can do on their own in their home exercise program. And I think that would be a great way of engaging that person and really giving them a little freedom to do some of that stuff on their own, right? Make sense? Sweet. So great question. Appreciate it. Again, head to MikeReinold.com. Click on that podcast link, and you can fill out the form to ask us more questions like that. Keep them coming, and we'll keep answering. Nobody listens this far in the episode probably, so we can just freely talk right now. I'm pretty sure I delete some of the questions there, but we have like over 1,000 questions.
Wow.
I've had over 1,000 questions coming. We answer a lot, right? We've had almost 200 episodes now. We get a ton of questions, but we try to pick out the ones that are most applicable to everybody. So keep them coming, and we'll see you on the next episode.